Hey there, before you scroll past this video, let me ask you something that maybe nobody's had the guts to ask you directly. How much is it costing you in money and confidence and in peace of mind that your body isn't responding the way it used to? I'm Dr. Claire Whitman, and in my 20-plus years practicing urology here in Canada, I've seen hundreds of men, good men, brave men, who've tried expensive pills, trendy remedies, miracle treatments that promise results in minutes, and yet they always end up back at square one. The response is inconsistent, and the frustration keeps coming back. Why? Because they're treating the symptom, not the cause. Now listen, I'm going to cut right to the chase here because I know you don't want me rambling on for ages. The solution I'm about to share with you costs less than your morning coffee at Tim's. It's backed by solid science, and it addresses the root problem instead of just masking it temporarily. I'm talking about folic acid. Yeah, you heard that right. That humble B vitamin that most people associate with pregnancy. But here's what nobody's telling you. It's one of the most powerful tools we have for supporting healthy erectile function, especially as we get older. Before I explain how this works, let me give you the practical information first, because I know that's what you're really here for. Here's what you need to know. The recommended dose is typically 400 to 800 micrograms daily. That's 0.4 to 0.8 milligrams if you're looking at the label. You can take it in the morning with breakfast, or in the evening with dinner, doesn't really matter as long as you're consistent. You can find it at any pharmacy, Shoppers Drug Mart, Rexall, wherever you normally go. It costs about $10 to $15 for a 3-month supply. No prescription needed. Now, I know some of you watching this are thinking, but doc, I'm 80 years old. Is this safe for me? Absolutely. In fact, folic acid becomes even more important as we age because our bodies don't absorb nutrients as efficiently. It's safe for older gentlemen. It doesn't interact with most common medications like blood pressure pills or diabetes meds. And it supports your cardiovascular health at the same time. That's a win-win if you ask me. Most people notice subtle improvements within 4 to 8 weeks. Things like better energy in the morning, more consistent morning erections, and gradually better response when it matters. This isn't a magic pill that works in 30 minutes. It's about rebuilding your body's natural capacity over time. All right. Now that you know the what and the how, let me explain the why, because understanding this will help you stick with it. And trust me, consistency is everything here. The real issue, the one that expensive treatments don't address, is something called endothelial dysfunction. The endothelium is this thin layer of cells lining your blood vessels, including the ones down there. Think of it as the gatekeeper for blood flow throughout your entire body. When it's healthy, it produces something called nitric oxide, which is absolutely essential for achieving and maintaining an erection. Nitric oxide tells the smooth muscles in your blood vessels to relax, allowing blood to flow in. No nitric oxide, no relaxation. No relaxation, no erection. It's that simple. Here's the thing though. As we age, especially if we've got high cholesterol, high blood pressure, diabetes, or if we've been smokers, that endothelium gets damaged. It's like a garden hose that's been left out in the winter here in Canada, you know? It gets brittle, doesn't work as well. When your endothelium is damaged, it can't produce enough nitric oxide, and that's when problems start. Now, those expensive pills you see advertised everywhere, the blue ones, the yellow ones, they work by blocking an enzyme that breaks down nitric oxide, so whatever little bit you're producing lasts a bit longer. That's fine for a quick fix, and I'm not saying they don't have their place, but they're not solving the real problem. They're like bailing water out of a leaky boat without fixing the hole. Plus, they're crazy expensive. They can cause side effects like headaches and flushed skin. And you've got to time everything perfectly. Not exactly spontaneous, eh? This is where folic acid comes in, and this is the part that gets me excited because it's so elegant and yet so overlooked. Folic acid works at the root level. It helps your body produce more nitric oxide naturally by improving endothelial function. There's solid research showing that when people have low folate levels, their endothelium doesn't work properly. Supplementing with folic acid helps restore that function. It also reduces levels of something called homocysteine, which is an amino acid that damages blood vessels when it builds up. Think of homocysteine as rust on those pipes. Folic acid helps clear that rust away. Let me tell you about a patient I saw a few years back. We'll call him Robert. He was 76, came into my office pretty frustrated. He'd tried the prescription meds, spent hundreds of dollars every month, and sure, they worked sometimes, but not consistently. He was also dealing with high blood pressure and borderline diabetes. I looked at his blood work and noticed his homocysteine was elevated and his folate was on the low side. I suggested he start taking folic acid daily, along with making some lifestyle changes. Nothing dramatic, just walking more, cutting back on processed foods, that sort of thing. I told him straight up, "Robert, this isn't going to work overnight. Give it 2 months." He was skeptical, but he trusted me. About 6 weeks later, he came back for a follow-up. He said he noticed his energy was better first, then he started having more morning erections, which he hadn't had in years. By 3 months, he told me things were working better than they had in the past 5 years. And get this, his blood pressure improved too, and his doctor was able to reduce one of his medications. That's the beautiful thing about addressing the root cause. You get benefits across the board. Now, I'm not saying folic acid is going to give you the performance of a 20-year-old. That's not realistic, and anyone who promises you that is lying. But what it can do is help your body function the way it's supposed to at your age. It supports healthy blood flow, it protects your blood vessels, and over time that translates into better, more consistent function. Here's something else that really matters. Folic acid is safe. I mean really safe. Unlike a lot of supplements out there that are poorly regulated or have questionable ingredients, folic acid has been studied extensively for decades. It's water soluble, which means if you take a bit more than you need, your body just gets rid of the excess. You don't have to worry about it building up to toxic levels. The upper limit is set at 1,000 micrograms daily, but most people do great with 400 to 800. Side effects are extremely rare, usually just some mild stomach upset if you take it on an empty stomach, which is why I recommend taking it with food. For those of you wondering about interactions, here's the deal. Folic acid plays nicely with most medications. If you're on blood thinners like warfarin, just let your doctor know you're starting it so they can keep an eye on your levels. If you're taking methotrexate for arthritis or psoriasis, check with your doc first because those two can interact. But for most people on common meds, blood pressure pills, statins, diabetes medications, you're good to go. Let me address another question I get all the time. Doc, can I just get folic acid from food? Technically, yes. Folate, the natural form found in food, is in leafy greens like spinach and kale, legumes like lentils and chickpeas, fortified cereals, and citrus fruits. And absolutely, you should be eating these foods. But here's the reality. As we age, our digestive system doesn't absorb nutrients as efficiently. Plus, folate from food is less bioavailable than folic acid from supplements. Cooking destroys a lot of the folate in vegetables. So, while you should definitely eat your greens, getting a consistent therapeutic dose from food alone is tough. That's why supplementation makes sense. Now, let's talk about what else you can do to support this process. Because folic acid works best as part of a broader approach, think of it as the foundation, but you need to build on it. First, movement. I know, everyone tells you to exercise, but I'm not talking about running marathons or spending hours at the gym. Even just walking 30 minutes a day makes a massive difference for blood flow. When you move, your blood vessels produce more nitric oxide naturally. It's like priming the pump. During the winter months here in Canada, when it's -20 outside, walk around the mall, use a treadmill, do whatever works. Just keep moving. Second, what you eat matters. Foods that support nitric oxide production include beets. They're huge for this. Leafy greens, pomegranate, watermelon, nuts, especially walnuts and almonds, and fatty fish like salmon. On the flip side, try to cut back on processed foods, excess sugar, and trans fats. These damage your endothelium and work against what you're trying to achieve. Third, stress management. I know life throws curveballs, especially as we get older. Health concerns, family stuff, maybe you're worried about money or taking care of a spouse. But chronic stress wreaks havoc on your vascular system. It raises cortisol, which damages your endothelium and reduces nitric oxide. Find something that helps you decompress. For some guys, it's fishing. For others, it's woodworking or spending time with grandkids. Whatever works for you, make time for it. Fourth, sleep. This is non-negotiable. When you sleep, especially during REM sleep, your body produces testosterone and repairs blood vessels. If you're only getting 5 hours a night, you're sabotaging yourself. Aim for 7 to 8 hours. If you're having trouble sleeping, talk to your doctor about it. Sleep apnea is really common in older men, and it absolutely destroys erectile function because your oxygen levels drop at night. Fifth, and I've got to say this, if you're still smoking, you need to quit. I know it's not easy, believe me. I've helped dozens of patients through this process, but smoking is one of the worst things you can do for blood vessel health. It directly damages your endothelium and reduces nitric oxide. There are resources available through your provincial health plan, nicotine replacement therapy, counseling, whatever you need. It's worth it. Let me talk about realistic expectations for a moment, because I think this is where a lot of frustration comes from. When you're 20 or 30, yeah, things happen pretty quickly and consistently, but as we get older, that changes, and that's normal. It doesn't mean there's something fundamentally broken about you. It means your body needs a bit more support. Folic acid isn't going to make you 20 again, but it can help you function well for your age. You might notice that spontaneous morning erections start coming back more regularly. That's a great sign because it means your nighttime nitric oxide production is improving. You might notice that when you are in an intimate situation, things work more reliably. The key word there is reliably. Not always perfectly, but more consistently than before. I also want to address something that doesn't get talked about enough, the psychological component. When you've struggled with this for a while, anxiety creeps in. You start worrying about whether it's going to work, and that worry itself makes things worse. It becomes this vicious cycle. One of the benefits of using something like folic acid is that because you're addressing the physical issue at a foundational level, your confidence slowly starts to rebuild. As your body responds better, your mind relaxes, and that actually helps even more. It's a positive feedback loop instead of a negative one. All right, let's get into some common questions because I know there's probably stuff I haven't covered that you're wondering about. Can I take folic acid with those prescription ED meds? Yes, absolutely. In fact, some doctors, myself included, sometimes recommend both. The folic acid works on the long-term health of your blood vessels, while the prescription med gives you a boost when you need it. Just make sure you're taking the prescription med as directed by your doctor. How long do I need to take folic acid? Think of it like taking a multivitamin. It's something that supports your ongoing health. Most of my patients stay on it indefinitely because the benefits go beyond just erectile function. It supports your heart health, brain health, and overall vascular system. What if I don't see results after 2 months? First, make sure you're being consistent. Taking it 3 times a week isn't going to cut it. It needs to be daily. Second, look at the other factors. Are you moving enough? How's your diet? Are you managing stress? If you've been consistent with everything for 3 months and you're not seeing any improvement, then it's time to dig deeper. Come see your doctor. There might be something else going on, like low testosterone or a more significant vascular issue that needs attention. Is the brand important? Honestly, not really. Folic acid is folic acid. You don't need to buy some fancy, expensive brand with a bunch of marketing hype. Generic folic acid from your local pharmacy works just fine. Just check that it's got the dose you want, usually 400 or 800 micrograms per tablet. Can I take more than 800 micrograms? You can. Up to about 1,000 micrograms is considered safe, but more isn't necessarily better. Your body can only use so much. Stick with the 400 to 800 range unless your doctor specifically tells you otherwise. Here's what I want you to take away from all this. You've got more control over this situation than you think. Yes, aging brings changes, and some things are beyond our control. But your vascular health, your blood flow, your body's ability to produce nitric oxide, these are things you can influence. Folic acid is a simple, safe, inexpensive tool that works with your body's natural processes instead of forcing a temporary response. I've been doing this for over 20 years now, and I've seen a lot of trends come and go. Fancy supplements that promise miracles, expensive treatments that work for a while then fade, all sorts of things. But the fundamentals don't change. Healthy blood vessels, good circulation, proper nutrition, consistent habits. That's what makes the difference in the long run. If you take nothing else from this video, remember this. Folic acid, 400 to 800 micrograms daily, taken consistently with meals for at least 2 to 3 months. Combined with regular movement, a decent diet, stress management, and good sleep. That's your game plan. It's not sexy, it's not flashy, but it works. And listen, if you're 80 years old watching this and you're thinking it's too late, let me stop you right there. It's not. I've had patients in their 80s see real improvements. Your body is remarkably resilient, even at that age. Give it the support it needs and it'll respond. I hope this has been helpful for you. If you've got questions, drop them in the comments below and I'll do my best to answer them. If you found this useful, hit that subscribe button because I've got more videos coming on related topics. Foods that support vascular health, exercises that improve circulation, how to talk to your doctor about these issues, all that good stuff. Take care of yourselves out there. And remember, small, consistent changes add up to big results over time. You've got this.